Chapter 3, Basic Medical Terminology, the Human Body, and the Cardiovascular System. Chapter Objectives. 1. Define word elements such as roots, prefixes, and suffixes. 2. Combine elements to make words and divide complex words into these elements. 3. Define basic terms used in the laboratory. 4. Describe the basic functions of the cardiovascular system. 5. Identify chambers of the heart and major heart blood vessels. 6. Distinguish the characteristics of arterial, venous, and capillary blood. 7. Locate the veins most commonly used for phlebotomy. 8. Define hemostasis and list 5 basic steps in the coagulation blood clotting sequence. Basic medical terminology. To be an effective member of a healthcare team, one must learn how to pronounce basic medical terms and know what they mean. Medical terminology becomes easier with practice and by using fundamental tools to understand how words are formed. Medical terms or words consist of several parts. Root, the main part of the word that describes what the word is about. For example, cardio is the word root for heart. So every time a medical term contains cardio, it means it has something to do with the heart. And phlebe is a word root relating to vein. Thus, the root provides the medical meaning. Knowing the meaning of roots allows knowledge about the word without having to look it up each time you see it in a medical term. Prefix, a word element that is added before the root at the beginning of the word. It makes the word more specific. For example, endo is the prefix meaning inside. Not every medical term contains a prefix. Suffix, a word element that is added after the root at the end of the word. It also adds to the meaning of the root. For example, itis is the suffix for inflammation, and Tommy is the suffix for cut or incision. Most medical terms contain a suffix. Combining vowel. Sometimes a vowel, usually I, O, U, or Y, is added to make a word easier to pronounce. Combining the examples used above would result in the words endocarditis, which means the inflammation of the inside lining of the heart. In this example, there was no need to add a combining vowel. Phlebotomy, which means a cut or incision into the vein. In this example, the O is in the middle helps make the pronunciation easier. When different prefixes or suffixes are added to the word root, the meaning changes. You can build a huge medical vocabulary by learning the meaning of word parts and how to combine them. Figure 3.1 and tables 3.1, 3.2, and 3.3. Tables 3.1 and 3.3 list selected prefixes and suffixes and their meanings that you will use as your medical terms. The word roots listed in table 3.2 are used to build medical terms that relate to the cardiovascular system. Table 3.1, primary word elements, prefixes. Prefixes that pertain to position, location, direction, or placement. Ab, away from. Add, toward. Ana, or A-N-A, up. Ante, or A-N-T-E, before. Cata, or C-A-T-A, down. Circum, or peri, C-I-R-C-U-M, circum, peri, P-E-R-I, around. Endo, E-N-D-O, within, innermost. Epi, E-P-I, upon, above. Ex, E-X, out, away from. Extra, E-X-T-R-A, outside, beyond. Hyper, H-Y-P-E-R, above, excessive. Hypo, H-Y-P-O, below, deficient. Infra, I-N-F-R-A, below. Inter, I-N-T-E-R, between. Intra, I-N-T-R-A, within. Meso, M-E-S-O, middle. Para, P-A-R-A, beside. Retro, R-E-T-R-O, backward. Sub, S-U-B, below or under. Supra, S-U-P-R-A, above, beyond. Trans, across, or trans, T-R-A-N-S, across or through. Prefixes that pertain to numbers, amounts, or speed. Ambi, A-M-B-I, both. Bi, B-I, two or double. Brady, B-R-A-D-Y, slow. Centi, C-E-N-T-I, 100. Deca, D-E-C-A, 10. Dipl, D-I-P-L, double. Di, D-I, 2. Hyper, H-Y-P-E-R, above, more than normal. Hypo, HYPO, below or deficient. Milli, MILLI, 1,000th. Mono, MONO, 1, single. Multi, MULTI, many, much. Nully, NULLI, none. Poly, POLY, many. Primi, PRMI, first. Quadri, QUADRI, 4. Quint, QUINT, 5. Semi, SMI, or hemi, HEMI, half. Tachy, TACHY, fast. Tetra, TETRA, 4. Tri, TRI, 3. Uni, UNI, 1. Prefixes that are descriptive and are used in general. A, an, without or lack of. Anti, ANTE, anti, ANTI, contra, CONTRA, against. Auto, OUTO, self. Breaky, BRCHY, short. Brady, BRADY, slow. CAC, CAC, or mal, MAL, bad. DE, reversal of or without. Dia, DIA, through. DYS, bad, before, or difficult. EU, good or normal. Hepat, HEPAT, related to the liver. Hetero, HETERO, different. Homeo, HOMEO, similar or same. Hydro, HYDRO, water. Mal or MAL, bad, inadequate. Mega, MEGA, large or great. Micro, MICRO, small. Neph or NEPHR, related to the kidney. Oligo, OLIGO, scanty or little. Pan, PAN, all. Pseudo, false. Pseudo, SEUDO, false. Re, again and again. Sim, SYM, or sin, SYN, together. Table 3-2, primary word roots related to the cardiovascular system. Root, ang, A-N-G, angle with the L, A-N-G-L. Vas, V-A-S, means vessel. Angin, or A-N-G-I-N, means to choke. Arter, or A-R-T-E-R, means artery. Arterio, or artery, A-R-T-E-R-I, or A-R-T-E-R-I-O, artery. Arthur, or arthero, A-T-H-E-R, or A-T-H-E-R-O, fatty substance or deposit. Capillus, C-A-P-I-L-L-U-S, hair-like. Card, C-A-R-D, heart. Cardi, C-A-R-D-I, or cardio, C-A-R-D-I-O, heart. Infarct, I-N-F-A-R-C-T, infarct, necrosis of an area. Lipid, L-I-P-I-D, fat. Logos, or L-O-G-O-S, study. Man, or mano, M-A-N, or M-A-N-O, thin. My, or myo, M-Y, or M-Y-O, muscle. Phlebe, P-H-L-E-B, vein. Phlebo, P-H-L-E-B-O, vein. Pulmonar, P-U-L-M-O-N-A-R, lung. Table 3-2, primary word roots related to cardiovascular system continued. Cubitum, or C-U-B-I-T-U-M, elbow or forearm. Cyte, or C-Y-T-E, cell. Derm, D-E-R-M, skin. Diastole, or diastolo, or D-I-A-S-T-O-L, or D-I-A-S-T-O-L-O, dilating. Electra, or electro, E-L-E-C-T-R, or E-L-E-C-T-R-O, electricity. Embol, E-M-B-O-L, to cast, to throw. Erg, or ergo, E-R-G, or E-R-G-O, work. Erythro, or erythra, E-R-Y-T-H-R-O, or E-R-Y-T-H-R, red. Heme, or hemo, H-E-M, or H-E-M-O, blood. Rhyth, R-R-H-Y-T-H, rhythm. Sear, S-C-I-E-R, hardening. Sera, S-E-R-A, serum. Sphygm, or S-P-H-G-Y-M, Sphygmo, S-P-H-G-M-O, S-P-H-Y-G-M-O, pulse. Steth or stetho, S-T-E-T-H, S-T-E-T-H-O, chest. Systole or systolo, S-Y-S-T-O-L or S-Y-S-T-O-L-O, contracting. Tens, T-E-N-S, tension. Thrum, T-H-R-O-M-B, clot. Vene or veni, V-E-N or V-E-N-I, vein. Table 3.3, primary word elements, suffixes. Algia, A-L-G-I-A, dynia, D-Y-N-I-A, pain. Cele, C-E-L-E, hernia, tumor, swelling. Emesis, E-M-E-S-I-S, is vomiting. Itis, I-T-I-S, is inflammation. Lysis, L-Y-S-I-S, destruction or separation. Megaly, M-E-G-A-L-Y, enlargement or large. Oid, O-I-D, resemble. Plegia, P-L-E-G-I-A, paralysis or stroke, or plegia, P-L-E-G-I-A, paralysis or stroke. Ptosis, P-T-O-S-I-S, drooping. Oma, O-M-A, tumor. Osis, O-S-I-S, condition of. Pathy, P-A-T-H-Y, disease. Penia, P-E-N-I-A, deficiency. Phobia, F-O-B-I-A, fear. Ptysis, P-T-Y-S-I-S, spitting. Raj, R-R-H-A-G-E, bursting forth. Rajia, R-R-H-A-G-I-A, bursting forth. Rhea, R-R-H-E-A, flow or discharge. Rhexis, R-R-H-E-X-I-S, rupture. Suffixes used in diagnostic and surgical procedures. Centesis, C-E-N-T-E-S-I-S, surgical puncture. Desis, D-E-S-I-S, binding. Ectomy, E-C-T-O-M-Y, surgical excision. Gram, a weight or picture. Gram, G-R-A-M, a weight or picture. Graph, G-R-A-P-H, to write or record. Meter, M-E-T-E-R, M-E-T or metry, M-E-T-R-Y, measure. Opsy, O-P-S-Y, to view. Plasty, P-L-A-S-T-Y, surgical repair. Plexy, P-L-E-X-Y, surgical fixation. Raphy, R-R-H-A-P-H-Y, suture. Scope, S-C-O-P-E, instrument. Scopy, S-C-O-P-Y, to view. Stasis, S-T-A-S-I-S, control or stopping. Stomy, S-T-O-M-Y, surgical opening, surgically created opening. Therapy, T-H-E-R-A-P-Y, treatment. Tome, T-O-M-E, instrument to cut. Tomy, T-O-M-Y, incision. Suffixes that are used in general. Blast, B-L-A-S-T, immature cell, germ cell. Cyte, C-Y-T-E, cell. Ist, I-S-T, one who specializes, or agent. Logy, L-O-G-Y, study of. Lysis, L-Y-S-I-S, breaking, destroying. Phagia, F-A-G-I-E-A, to eat. Phasia, F-A-S-I-A, to speak. Philia, F-P-H-I-L-A, attraction. Praxis, P-H-R-A-X-I-S, to obstruct development. Physis, P-H-Y-S-I-S, growth. Plasia, P-L-A-S-I-A, formation, produce. Pnea, P-N-E-A, breathing. Poiesis, P-O-I-E-S-I-S, formation. Therapy, T-H-E-R-A-P-Y, treatment. Trophy, T-R-O-P-H-Y, nourishment, development. Urea, urine. Urea, U-R-I-A, urine. Basic rules for combining word elements. Medical terms are different from everyday English language because they sound different. They come primarily from Greek or Latin origins. There can be more than one word element for a particular meaning, and changing simple prefix or suffix can change the entire meaning. Box 3.1. Box 3.1, using common suffixes. Following are some examples of usage of common suffixes. The suffix Logy, or Logy, is commonly used in healthcare and means the study of, and itis means inflammation of the. Term, cardiology, the study of diseases of the heart, arteries, veins, and capillaries. Cytology, the study of cellular structure and functions. Dermatology, the study of the skin. Endocrinology, the study of diseases of the endocrine, glands, and hormones system. Gastroenterology, the study of diseases of the intestinal or digestive system. Gynecology, the study of diseases of the female reproductive system. Hematology, the study of blood. Histology, the study of microscopic structures and tissues. Immunology, the study of diseases of the immune system. Microbiology, the study of microbes. Nephrology, the study of diseases of the kidney and the urinary system. Neurology, the study of diseases of the nervous system. Oncology, the study of tumors and cancer therapy. Parasitology, the study of parasites. Pathology, the study of pathogens or disease-causing agents. Serology, the study of antibodies in the serum. Urology, the study of the urinary system. Virology, the study of viruses. Appendicitis, the inflammation of the appendix. Dermatitis, inflammation of the skin. Hepatitis, inflammation of the liver. Meningitis, inflammation of the meninges. Osteomyelitis, inflammation of the bone. Many terms for the body organs or structures originate from Latin. For example, vessel comes from the Latin word vessilium, or little vessel, and capillary originates for capillaris, or hair-like. Most of the terms that describe disease originate from Greek. For example, lipo means fat and oma means tumor. So lipoma means a fatty tumor. Hepat means liver, and itis means inflammation. So hepatitis means inflammation of the liver. A few basic rules make medical terminology easier to learn and to use, and help us to avoid mistakes. Practice using medical terminology with someone who is familiar with the correct pronunciation. A study partner can give you tips about the sound of the word so that confusion is avoided. It is even recommended that you read this section out loud. Following are some basic tips on pronunciation. Ch or ch sounds like k. For example, chronic, chronic, is pronounced chronic. PS sounds like s. For example, psychology, psychologgy. PN sounds like N, for example, pneumonia, pneumonia. C sounds like S when it comes before E, I, and Y. For example, cytoplasma, cytoplasm. Centrifuge, centrifuge. G sounds like J when it comes before E, I, and Y. For example, generic, generic. I sounds like I or EYE when added to the end of a word to form a plural. For example, bacilli, bacilli. Bronchi, bronchi. The combining vowel is most often an O. For example, osteoporosis is a condition in which the bone becomes porous. It is easier to say with the addition of the O than to say osteoporosis. It is easier to say osteoporosis than say osteoporosis. When changing a word from singular to plural, substitute the plural ending as follows: ax, as in thorax, to aces, as in thoraces. In X, as in phalanx, to GES, as in phalanges. EN, as in foramen, to INA, as foramina. IS, as in crisis, to ES, as in crises. IX, as in appendix to ICES, as appendices. ON, as spermatozoon, as A, as in spermatozoa. as in ovum to A as in ova. US as in nucleus to I as in nuclei. Y as in artery to I and add ES as in arteries or phlebotomy to phlebotomies. Terms for anatomical direction and position. Anatomical terms provide a description of the body's landmarks. These terms are helpful during an assessment of a patient to make the patient's condition understandable to others. The following terms may be useful when describing or evaluating a venipuncture complication: an interfering surgical wound site, the location of a vein or artery, or a potential venipuncture site. See Figure 3.2 and Box 3.2. Anterior, the front of the body. Example, I will draw blood from the anterior side of the arm. Posterior, towards the back of the body. Example, there is a large bandage on the posterior side of the arm. Medial, towards the midline, opposite of a lateral direction. Example, the heart is medial to the right shoulder. Lateral, towards the sides of the body, opposite of the medial direction. Example, the hip is lateral to the navel. Figure 3.2 shows terms related to body orientation. Body movements and locations can be described in terms related to imaginary planes that divide the body. A, the sagittal plane or midline divides the body into two halves. B, the plane that divides the body into the front and back is referred to as the superior inferior plane or the cranial caudal plane. Box 3.2, right and left sides, the patients or the healthcare workers. When speaking with patients, healthcare workers should refer to the patient's right and the patient's left sides. This comes up when the healthcare worker asks to see the patient's right or left arm prior to the vein selection for venipuncture. Even though the task seems easy, some healthcare workers confuse right and left arms when they are face-to-face with a patient. Practice by facing a friend and pointing to the friend's right and left side until it is done correctly each time. Do not confuse your own right and left with the patient's right or left side. The task becomes important when there are specific instructions to collect blood specimen from only one side of the patient because of a clinical condition. Distal, away from the center or point of attachment. Example, the rash was spreading distal to the elbow and all the way to her fingers. Proximal, near the center or point of attachment opposite of distal. Example, her leg broke on the proximal side of the knee. External or superficial, near the surface of the body. Example, superficial veins are easily missed unless you feel for them. Internal or deep, far from the surface of the body. Example, major arteries are in the deep tissues. Other terms sometimes used are dorsal for back side and ventral for the front side. Example, the lesion was on the ventral side of the knee. Terms that describe body positioning can help you communicate details related to the patient prior to, during, or after phlebotomy procedures, as shown in Figure 3.3. These include the following: normal anatomic position, erect standing position with arms at rest and palms forward. Never perform a venipuncture on a patient who is standing because of the risk of fainting or falling. Supine position, lying or reclining face up on his or her back, the best position for performing phlebotomy on patients who are in bed. Prone position, lying with face toward the bed on his or her stomach, not recommended position for venipuncture because of the awkward orientation of the arms. Lateral recumbent position, lying on the left or right side, not recommended position for venipuncture because the patient can easily roll over, increasing the risk of harmful needle insertion. The human body, homeostasis. The design of the human body is elaborate and sophisticated. Trillions of cells make up each individual. Similar groups of cells are combined into tissues, such as muscles and nerves, and tissues are combined into organ systems, such as circulatory or reproductive system. These organ systems work simultaneously to serve the needs of the body for survival. No one system works independently of the others. The body strives for a steady state, or homeostasis. Literally, homeostasis means remaining the same. It is a condition in which a healthy body, although constantly changing and functioning, remains in a normal, healthy condition. Homeostasis, or a steady state of condition, allows the normal body to stay in balance by compensating with changes. For example, if the body is taking in too much water, It responds to this imbalance by excreting water from the kidneys or urine, skin, as in perspiration, intestines, such as feces, and lungs, such as the water in one's breath. A healthy body maintains constancy of its chemical components and processes in order to survive. Each organ system and body structure plays a part in maintaining homeostasis. Healthcare workers can assess homeostasis or normal functioning by taking vital signs. For example, temperature, pulse rate, respiration rate, together known as TPR, and blood pressure. Another way to monitor normal functioning is to perform laboratory analysis on blood specimens as shown in box 3.3. Refer to figure 3.4 to learn more about each organ system and types of laboratory tests that are useful in evaluating each system. Cardiovascular system. All body systems are linked by the cardiovascular system, a transport network that affects every part of the body within seconds. See Table 3.4. To maintain homeostasis, the cardiovascular system must provide rapid transport of water, nutrients, electrolytes, hormones, enzymes, antibodies, cells, and gases, oxygen and carbon dioxide, to all cells. In addition, the cardiovascular system helps bodily defenses, controls the blood circulation coagulation process, and controls body temperature. The term cardiovascular refers to the cardiac muscle, i.e. the heart. Refer to figure 3.5. The vascular system, i.e. a network of blood vessels that includes veins, arteries, and capillaries, and the circulating blood. Refer to box 3.4. Box 3.3, laboratory specimens and how they are used. Laboratory test results provide information about an individual's organ systems in general. Laboratory results are used for the following reasons. Diagnosis, such as heart enzyme levels, which help to establish the diagnosis of a heart attack. Monitoring, such as glucose levels, that are used to monitor treatment of diabetes. Therapy, such as drug levels, can help determine effective dosage and prevent toxicity. Screening, such as tests such as prostatic specimen antigen, can help in the detection of prostate cancer. The most common body samples used for clinical laboratory analysis are blood and urine. However, other specimens such as bone marrow, cerebrospinal fluid, or CSF from around the spinal cord, synovial fluid or joint fluid, pleural fluid from around the lungs, biopsy tissue, semen, and others can be microscopically analyzed, assayed, and cultured to determine pathogenesis or the origin of the disease. Healthcare workers who collect blood specimens may also have a part in the collection, transportation, processing, or testing of all types of body specimens. Many of these, such as bone marrow, CSF, biopsy tissue, and synovial or pleural fluids, are acquired from the patient by the physician and a team of assistants through the use of invasive procedures, those requiring the medical instrument be inserted directly into the body cavity or organ. These specimens must be handled and transported in a similar manner to blood specimens with the utmost care and efficiency. Health facilities often have special procedures for handling, transporting these types of specimens. Healthcare workers must understand that these specimens are much more costly and difficult to acquire than blood samples in terms of discomfort to the patient and healthcare resources needed to acquire them. Thus, even if it is possible to get a repeat specimen, it is extremely uncomfortable to the patient, inefficient, and costly. Figure 3.4 shows the different organ systems and the major functions, common disorders, and common laboratory tests. First is the integumentary system, which is the skin. Its major function is protection, temperature, regulator, and sensory receptor. Common disorders are infections, cancers. Common laboratory tests are skin scrapings, potassium hydroxide, KOH preparation, and biopsy staining procedures. The skeletal system, which is the major function is framework and movement, shape, support, protection, and storage, place for minerals. Movement is made possible through the joints. Common disorders are arthritis, gout, tumors, infections, developmental conditions such as dwarfism. Common laboratory tests are calcium phosphate, alkaline phosphatase, uric acid, vitamin D, blood cell counts, cultures, and cytogenic analysis. The muscular system. Major function is the framework and movement. Muscles produce movement, maintain posture, and produce heat. Common disorders are muscular dystrophy, multiple sclerosis, tendinitis, and infections. Common laboratory tests are muscle enzymes such as creatinine, phosphokinase or CK, and lactose dehydrogenase. Nervous system serves for communication and control, transmits impulses, responds to change, is responsible for communication and exercise control over all parts of the body. Common disorders are infections such as meningitis, encephalitis, tumors, epilepsies, Parkinson's disease, amyotrophic lateral sclerosis or ALS. Common laboratory tests are hormone, protein, and enzymes analysis and microbial cultures. Endocrine system. Major function is communication and control. The glands of the endocrine system produce hormones, chemical messengers that provide for communication and control over various parts of the body. Common disorders are Addison disease, Cushing's syndrome, diabetes, hyper or hypothyroidism, and goiter. Hormone, the type of common laboratory test or hormone analysis, thyroid function test. Cardiovascular system. The major function is transportation and immunity. Transports oxygen and carbon dioxide, delivers nutrients and hormones, regulates blood clotting, and removes waste products. And common disorders are of tumors, heart disease, and hemophilia. Common laboratory tests are heart enzymes, hemoglobins, hematocrit or H&H, cell counts, platelet function tests, coagulation factors, bone marrow analysis, cytogenic analysis. Lymphatic system. Major function, transportation, and immunity. The lymphatic system stimulates immune response, protects the body, and transports proteins and fluids. Common disorders are tumors, lymphoma, Hodgkin's disease, immune disorders, and infections. Common laboratory tests are bone marrow analysis and immune function tests. Respiratory system. The major function is distribution and elimination. Furnishes oxygens for use by individual tissue cells and removes their gaseous waste products or carbon dioxide. Common disorders are infections such as pneumonia, tuberculosis, sore throats, laryngitis, cough, colds, and influenza. Common laboratory tests are blood gases such as CO2 and O2 and blood pH, electrolytes, sodium chloride and potassium, bicarbonate, and microbial cultures. Digestive system, major function, distribution and elimination, digestion, absorption, and elimination. Common disorders are periodontal disease, stomach disorders such as ulcers and acid reflux, hernias, intestinal disorders such as appendicitis. Common laboratory tests are occult blood tests, microbial cultures, and parasitic analysis. Urinary system, major function, distribution and elimination, produces urine, transports urine, and eliminates urine. The kidneys help maintain electrolyte, water, and acid-base balance of the body. Common disorders are acidosis and alkalosis. Common laboratory tests are protein, glucose, ammonia, creatinine, blood urea, nitrogen, and electrolytes. Reproductive system, major function, cycle of life, responsible for sexual characteristics of male and female. Proper functioning ensures survival of the human race. Common disorders, tumors, infertility, cysts, cancers, and sexually transmitted diseases. Common laboratory tests, cytogenic analysis, semen analysis, biopsies, hormone analysis, prostatic specific antigen or PSA. Table 3-4, the cardiovascular system, the heart. Primary function of the heart is a muscular organ about the size of an adult's closed fist. Contractions push blood through the body. Average heartbeat 60 to 80 times per minute. The aorta is the largest artery of the body. Supplies oxygenated blood to the circulatory system. It exits the heart from the left ventricle and runs downward in front of the spine. Atria and ventricles are the two upper and two lower chambers of the heart, respectively. Atria is the upper, the ventricles is the lower, and they contract to push blood through the heart. They are described as the right and the left atria and the right and the left ventricles. Vena cava. Vena cava are the largest veins of the body carrying deoxygenated blood into the heart. The inferior vena cava carries blood from the lower body, and the superior vena cava carries blood from the head and the upper body. Pulmonary artery or veins. The right ventricle of the heart pumps blood into the pulmonary arterial branches that go into the right and left lungs. Then they branch into the arterioles and capillaries to exchange O2 and CO2. The capillaries then flow into the venules and back into two pulmonary veins, the right and the left, that return blood to the heart through the left atrium. Note, the pulmonary veins are different in that they are the only veins that contain high O2 content. All other veins carry blood with low O2 content. Likewise, pulmonary arteries are the only ones that contain a low O2 content. Arteries. Arteries transport blood from the right and the left chambers of the heart to the entire body. Large arteries branch into arterioles the farther they are from the heart. They carry oxygenated blood that is bright red in color, have thicker elastic walls than veins do, have a pulse, and are located deep in muscle tissue. Veins. Veins transport blood from peripheral tissues back to the heart and lungs. Large veins branch into venules in the peripheral tissues. They carry deoxygenated blood back to the lungs to release carbon dioxide. They carry blood that is normally dark red in color. They have thinner walls than arteries and appear bluish, have valves to prevent black flow of blood, and they are located both deep and superficially or close to the surface of the skin. Capillaries. Capillaries connect arterioles with venules via microscopic vessels. Capillaries exchange oxygen and carbon dioxide, nutrients and fluids in tissue capillaries, pass waste products from tissue cells into capillary blood, then on to remove from the body. They carry blood that is a mixture of arterial blood and venous blood. Circulating blood. Circulating blood transports oxygen and carbon dioxide, nutrients and fluids, removes waste products, disperses nutrients, regulates body temperature and electrolytes, regulates the blood clotting system. Figure 3.5 shows the internal anatomy of the heart and the path of blood circulation. This is a diagrammatic frontal section of the heart showing the major structures. Numbers indicate the path of blood flow through the heart. B. The path of blood flow throughout the body. Arteries, red color, carry oxygen-rich blood oxygenated from the lungs and heart to the upper and lower body. Most veins carry oxygen-poor or deoxygenated blood from the upper and lower body back to the heart and lungs to pick up more oxygen. However, pulmonary veins carry O2-rich blood back to the heart from the lungs. Also, only the pulmonary arteries carry O2-poor blood from the heart directly to the lungs. Box 3.4, a study of your veins. Take a look at the superficial veins in one of your hands or in the hands of a friend. Try to find veins that are prominent and easy to see. Remember that arteries are located deeper in the tissue and are not visible. Study the characteristics. Bluish color is caused by the low oxygen carbon dioxide content. Direction of the blood flow. Venous blood flow is from the tips of the finger towards the heart because veins are taking blood back to the heart and lungs to get more oxygen. This can be visible by hanging your hand down low for a minute or two. Due to gravity, venous blood pools in the veins. Take note of how they become more prominent. Next, raise your hand up. The venous blood empties and the vein becomes less visible. Firmness. Some veins feel rather soft, whereas others are slightly firm. Try to compare the feeling of veins from different people of different ages. The more practice you have feeling, not seeing veins, the better your venipuncture outcomes will be. Figure 3.6. Become familiar with the principal veins of the arms and legs. Figures 3.7, figures 3.8, figures 3.9, and figures 3.10. Although every individual has slightly different venous pattern, always rely on feeling the best vein for venipuncture. Figure 3.6 shows a comparison of arteries, veins, and capillaries. Capillaries have thin walls, permit exchange of blood and fluids into surrounding tissues. They are so small in diameter that only one RBC can pass through it at a time. Veins have thinner walls than arteries, so they are more likely to collapse when blood is drawn. Arteries have thicker walls than veins, resist the strong pressure of blood being pushed through. Figure 3.7 shows the system of the upper torso and arm. The antecubital area of the forearm around the crease of the elbow is most commonly used for venipuncture. The median cubital vein is best for venipuncture because it is generally the largest and best anchored veins. Others in the antecubital area that are acceptable are the basilic vein and the cephalic vein. Figure 3.8 shows major arm veins. Note that the cephalic vein extends almost the entire length of the arm. The superficial median cubital vein serves as connection between the cephalic and basilic veins. The subclavian, brachial, and axillary veins are deeper veins. Figure 3.9 shows variations in venous patterns. Because all individuals are unique, the exact location of veins may vary from one person to another. This figure depicts variations in venous patterns in the arms of two individuals. Figure 3.10 shows the major veins of the legs. The femoral vein 1 is a deep vein. Note the greater saphenous vein 2 is the longest vein in the body. It ascends up the medial side of the leg and a medial thigh and empties into the femoral vein in the groin area. The lesser saphenous vein comes up the lateral side of the ankle and enters the deeper popliteal vein behind the knee. Also refer to Figure 3.11 that shows the positions of nerves of the arm. Note that veins, arteries, and nerves are all in close proximity to each other. So if a venipuncture procedure is not performed correctly, nerve damage and severe pain can result, and/or an artery can be punctured accidentally. The antecubital area, anterior side near the bend of the arm, is preferred for venipuncture. However, in some circumstances when veins of the antecubital area are not accessible, a puncture site must be on the back or the posterior side of the hand. See Figure 3.12. Never use the anterior or palm side of the wrist or hand to collect blood specimen because the risk of hitting a nerve is very high due to superficial nerve locations near the skin surface. Blood. Circulating blood is essential to homeostasis and to sustaining life. Any region of the body that is deprived of blood may die within minutes. Humans contain approximately 5 quarts or 4.73 liters of whole blood that is composed of water, solutes, dissolved substances, and cells. The volume of the blood in an individual varies according to the body weight. For example, men have 5 to 6 liters of whole blood. Adult women usually have 4 to 5 liters, whereas infants who weigh about 3 kilograms or 6.6 pounds may have between 240 and 340 milliliters of total blood volume. See Figure 3.13. When adequate blood volume is not maintained due to blood loss during traumatic accidents, complications during surgery, or anemia, a patient may require blood transfusion. Phlebotomists must understand that the consequences of excessive blood withdrawal for laboratory testing purposes can also cause inatrogenic anemia. Anemia caused by medical treatment itself, in this case by taking large volumes of blood during venipuncture procedures. Most healthcare facilities have guidelines about monitoring blood volumes, especially for pediatric patients. Blood is made up of the liquid portion, plasma, and cells. There are 3 main types of circulating blood cells that are summarized in Table 3.5 and Figures 3.14 and 3.15. Hematopoiesis is the body's mechanism for forming all of the cellular elements in blood. It occurs in the bone marrow, and every type of blood cell begins in the bone marrow, as a very immature cell called a stem cell. See Figure 3. Plasma. The liquid portion of blood is called plasma. It is about 90% water and 10% dissolved substances and cells. Normally, blood cells, gases, oxygen or carbon dioxide, proteins, glucose, and other chemical substances are suspended in plasma. It is the medium for transporting constituents in the bloodstream. If a chemical agent called an anticoagulant is added to the blood specimen to prevent it from coagulating or clotting, the specimen can be centrifuged and result in a layer of cells and a liquid plasma. The cellular portion of the specimen contains white blood cells, or WBCs, red blood cells, RBCs, and platelets. If the specimen is centrifuged or allowed to settle, the WBCs and platelets settle in a layer above the RBCs, called the Buffy coat. The fluid portion is straw-colored and normally clear enough to see through, and this portion remains at the top of the cells. It contains fibrinogen, a clotting factor, and other chemical substances. However, if the sample is mixed, the cells will again become suspended in the plasma, and it will again look like normal blood. Table 3.5 is on blood cells. Serum. If the serum specimen is allowed to clot, the resulting liquid portion changes from plasma to serum, also straw-colored and normally clear enough to see through, plus blood cells meshed in a fibrin clot. Serum contains essentially the same chemical constituents as plasma, except that the clotting factors fibrinogen in the blood cells are contained within the fibrin clot. See figures 317 and 318. Sometimes serum may appear turbid or cloudy or opaque or lipemic, milky appearance as a result of several conditions such as high lipid levels from eating fatty substances that lead to high cholesterol and triglyceride levels, or from bacterial contamination. In these cases, the appearance of the serum should be documented accordingly. Figure 316 is an example of hematopoiesis. Figure 317 shows blood specimens with and without anticoagulant before and after centrifugation. Hemostasis and coagulation. Hemostasis, hemo equals blood, stasis equals standing still, is the maintenance of circulating blood in the liquid state so that it does not clot spontaneously. Hemostasis is the body's mechanism to prevent blood loss when a blood vessel is injured by an incision or a puncture. When this does occur, the hemostatic process, blood clotting response, repairs the break and stops the hemorrhage by forming a blood clot. See figure 319. Essentially, the blood clot bridges the torn or punctured edges together. This entire coagulation process is an elaborate sequence of cellular and chemical reactions and steps taking place. Basically, the coagulation process involves the following intricate phases. The vascular phase. Once a blood vessel is injured, the vessel constricts or vasoconstricts to decrease the blood flow to the area. The platelet phase. Platelets degranulate, clump together, and stick to the injured site to form a plug and inhibit bleeding. The coagulation phase. Many coagulation factors, fibrinogen, clotting factors, and calcium are released and form a fibrin mesh or clot. Clot retraction. After the bleeding has stopped, the clot retracts to heal the torn edges of the vessels. Fibrinolysis. When the final repair is made, the injured vessel heals and the clot begins to dissolve or break up. This is lysis. Normally, slight pressure over a puncture site will stop bleeding. However, laboratory analysis is helpful in determining the number and functionality of platelets, the presence or absence of clotting factors, or the interference of drugs in the coagulation process. Some drugs, called blood thinners, are used to treat patients with a history of stroke, irregular heartbeat, artificial heart valves, or heart attack. These include aspirin, as seen in figure 320, heparin, Coumadin, warfarin, and clopidogrel or Plavix, and while they are useful in prevention, they also cause a patient to bleed for a longer period of time because they slow down the coagulation process. Phlebotomists must always assure that bleeding has stopped before leaving a patient. Healthcare workers regularly deal with patients who are bleeding. External bleeding is described according to the type of blood vessel injured and the color of the blood. Arterial bleeding. Bright red in color because of the high oxygen content. Bleeding is quicker, more abundant because of high pressure and spurts with each heartbeat. They are harder to control and require special attention from a nurse and/or doctor. If an artery is accidentally punctured, take immediate steps to terminate the procedure. Apply pressure to the site for at least 5 minutes and seek assistance. Report accidental arterial punctures immediately to a supervisor. Clinical alert. Bleeding should be anticipated during or after a venipuncture. Therefore, always use precautions, including gloves to avoid direct exposure. A mask, protective eyewear, a facial shield or gown should be worn if there is a huge chance or if there is a chance of blood splatters or if the patient is coughing up blood. Remember that some patients may be on blood thinners and will bleed more freely and longer than normal. Also, rarely during a venipuncture procedure, an artery may be accidentally punctured instead of a vein. This is a serious error and a procedure should be discontinued immediately. By removing the needle device, bleeding will be more abundant or of longer duration and in spurts. Direct pressure should be applied with gauze pads until it is stopped. Report the incident to a supervisor. Always ensure that bleeding is stopped before leaving the patient. If bleeding does not stop after a reasonable time or if it is excessive, call for help. Detailed procedures are covered in Chapter 8. Be careful with your choice of words. Box 3-5. As you become more proficient with the use of medical terms, remember that some words sound or look similar but have very different meanings. Here are some examples. Homeostasis, a steady state in the human body. Hemostasis, the blood coagulation system. Hematopoiesis, the process that makes blood cells. Palpation relates to examining by touching or feeling using fingers or hands, such as searching for a superficial vein in the antecubital area. Palpitation relates to a rapid heartbeat, such as when patients are stressed, they have perceptible heart palpitations. Venous bleeding. Venous bleeding. In venous bleeding, the blood is dark red in color because it lacks oxygen, occurs in a steady flow. Normal bleeding is easily stopped by applying pressure because venous pressure is lower than arterial pressure. Capillary bleeding occurs slowly and evenly because of smaller size of vessels and lower pressure. Easy to control with slight pressure, sometimes stopped without intervention. Blood is a color between the bright red of arterial blood and dark red of venous blood. And this concludes Chapter 3.